How to assemble your Fushan silicone drain. Open the sterile packaging containing the drain. Pass the inner packaging to the scrub nurse. Remove the drain and connector from the inner packaging. Note that for drain sizes of 10, 12, and 15 French, there is a connector for the reservoir bulb. Set the connector aside for later use. Lastly, open the sterile packaging containing the reservoir bulb. Next, remove the trocar tip protector by gently twisting it side to side. Use the trocar to puncture through the patient's skin and carefully pull the drain until you see a black line, which acts as a skin marker for suturing purposes. Cut off the trocar end. To connect the drain to the reservoir bulb, take the round end of the connector and insert it into the collar tip of the bulb using a twisting motion to screw it in. Make sure that the connector is fully inserted for a tight connection. Next, connect the tip of the connector to the drain using a twisting motion. Ensure that the connector is fully inserted for a tight connection. To create active suction at the reservoir bulb, press in the middle and fold the bulb twice to squeeze out the air. Screw the blue cap until it is finger tight. A well-vacuumed reservoir should look like a C shape as shown. The reservoir bulb should stay flat until it starts to fill with fluid. What should I do if the C shape does not appear, or the reservoir bulb expands immediately? First, check the connections at the connector, reservoir bulb, and drain. Make sure that there is still tight connection. Open the blue cap and recreate the vacuum by pressing in the middle and folding the bulb twice. Screw the blue cap until it is finger tight. A well-vacuumed reservoir should look like a C shape as shown.